Good evening, everyone, and thank you very much for coming to join us tonight on our webinar, which is about Healthdirect video call for telehealth and about telehealth more broadly. So my name is Nerida, and I'm joined tonight by Evelina. I'm a digital health program officer, and Evelina is one of our practice support officers. And we're going to talk to you tonight about telehealth. Evelina is going to cover, hopefully, any questions you have about item numbers and all sorts of bits and pieces about workflow, and I can help you out with the digital side of it and the setup of Healthdirect. But before we get, so telehealth, of course, came about. Well, it's always been about, but MBS items started last year. It seems like a long time ago. In March, they started the temporary COVID-19 telehealth items. Since then, we've had multiple changes, and even some changes were announced today, this afternoon. So please have a look at the MBS online website, which the link is here, and I believe the slides will come out to you, but it's definitely worth keeping an eye on that because it is updated quite frequently. The most recent changes were made on the 1st of July, and they have put more of an emphasis on video conferencing. So telehealth really encompasses both telephone and video, but now the majority of the items that are available are now video conference items. There do remain some telephone ones, but they're trying to sort of, I think, get people to use more of the video. And that is the numbers or the most frequent ones that you might use at the moment. So at the moment, they've got the less than 6 minutes telephone call and the longer than 6 minutes telephone call. And then all the rest of them, which used to exist as both telephone and video, are now predominantly just video conferencing. So again, the numbers are there. But as I said today, thank you to Scott Morrison, who announced just before our webinar that it seems likely that as of tomorrow, they're going to reinstate that level C, or the greater than 20-minute attendance, as a telephone item at the moment in Sydney, and I believe in the areas that are considered hotspots or coronavirus affected outbreaks and so on. So as we said, changes all the time, but it looks like that one will be coming back for telephone, but only for the short term, I believe. And presumably then it will go back to video conferencing preferred. The eligibility also can change. So again, please keep an eye on it. But right now, and this was as of this afternoon before the press conference, the eligibility is around, usually you need to have an established relationship with the practice and the patient, and that means that somebody in the practice has to have seen that patient in the previous 12 months face-to-face. But there are exemptions, and again, right now for Sydney, Greater Sydney is in an outbreak situation, in lockdown, so we would fall under that exemption of patients living in a COVID-19 impacted area. So it's my understanding that right now, this minute, if you need to do telehealth with any patient, whether you've seen them before or not, you would be able to claim that on the MBS. But as I said, you need to be quite careful, because as soon as we're not considered to be in a lockdown situation, or we're no longer in an outbreak, then that will revert to the established relationship patients only. And there's some other exemptions on there. And I guess the other good thing perhaps from the 1st of July was that they have put in that any person who needs pregnancy counselling, or any person that needs bloodborne virus or sexual or reproductive health counselling or consultations, can also use telehealth, and that is outside of that 12-month relationship. All of this is available on the MBS website, and as I said, the link was on the previous one, but we can always provide that to you as well. Now, video telehealth. So don't give up on your video just because you can do a more than 20-minute consultation now, please. There's other benefits. You know, there's a good reason to use video if you can. And of course, it's not going to be for everybody. Some of your patients may not have the hardware, they may not have a smartphone, or they may not have a way to do video conferencing, but those who do, it can be really worthwhile. Number one, you can maybe help with identification. You can see the person, you can see who's there, and you can see what's going on. Apart from that, there's other benefits. And now I'm not a medical practitioner, but I am a pharmacist who does medication reviews in another life. And I find that even if I just look at my patients that I'm seeing in the aged care facility, even if I can't talk to them, it helps me. It does help give some general ideas. So I might be able to see, do they look pale? Do they look lethargic? Do they look generally unwell or unhappy? So that general appearance can be useful. Of course, you might be able to say, you know, can you angle the phone down a bit further? Can I have a look at your ankle? Can I have a look at your arm, wherever you might have a rash or you might have some edema? So there can be benefits there. I've certainly seen some webinars where some other medical practitioners have suggested that you might be able to look at respiratory rate when you are visually seeing a person. I'm not as familiar with that, but that might be something you could do. And the other thing I think that's useful for video is that rapport. It's usually a bit easier to have a rapport with someone that you can see than just someone you're talking to on the telephone. So there's lots of reasons to use video apart from the push with the MBS items, and it hopefully will mean that, you know, you can undertake some more, what's the word? You know, it might help in your clinical decision making. So the platform that we can help you with in terms of video call, and look, there's really lots of video call platforms, and you might have it within your software or in other programs that you're already paying for or using. But the PHN is able to provide to any of our GP practices and as well to our allied health and aged care practices. We can provide you with a fully funded, no charge Healthdirect video call license. For our GPs, that is currently funded by the government until the 31st of December. That in the last year and a half or so, those deadlines have been extended a couple of times, and that's usually in line with the MBS items also being extended. So obviously I can't say that for sure, but you know, we know for sure we're right till the end of December, and then I think it would be potentially looking at what happens with the MBS telehealth items. But at the moment, no charge at all. It's a web-based program, so you don't need any software, you don't need any apps, you don't need anything downloaded onto your computer, and that is also the same for the patient. They don't need to have anything downloaded on their phone or their laptop or anything like that. It's purely through a web program. It is a secure program, and it has been made for purpose. It's made here in Australia. So it is made just for conducting health consultations. I think that's quite important because it means that all your data requirements, there's no patient information stored on, like, even if you had this open on your telephone, which you could do this on your smartphone if you, I don't know, if you were very enthusiastic and you wanted to do consultations at home, or maybe if you were in lockdown as a close contact and you had to do them at home, you could do this on your personal laptop or your tablet or your phone, and it is not it's not a risk. There's no patient information recorded. There's no sensitive information that is recorded in here. It's all secure. It's all encrypted. The consultation is not recorded. So there's no risks around that. The little bit of data that is retained, and it's pretty much metadata as far as I can tell, it's not identifiable, but anything that is retained here in Australia on servers. So again, it meets the data requirements which Australia has in place. And it is quite simple to use for both the clinicians and for the patients. So again, quite a useful thing. So I'm going to just run through a little bit of what it looks like, and hopefully, of course, if you have some questions, hopefully I answer them as we go along, but please, if you're not sure, you can write them in the box and we can come to it a bit later on. So as I said, it's just a web page. You just open up a browser, so your Google Chrome or your Safari on your phone or your Mac or your, what do you call it, iPad, or yeah, usually Chrome or Safari are the two they prefer. And you type into the bar vcc.healthdirect.org.au. And this is for the clinician side. This is not what the patient sees, but this is for the practice. You come to the page that is the login page. You will enter in your email address, which is your username. So now that, even if you set that up as your own personal email address, so it doesn't have to be a practice email address, nobody ever sees that. It's just for logging in purpose. It's not going to be shared with any patients. It's not, and like, as I said before, there's no information sent to it. There's no sensitive information. So you can, if you want to, use your Gmail or your Hotmail or whatever email to log in, and you put your password in. I would recommend that, hopefully you can see it on the screen, under that kind of peachy color login button, there's a little bit that says keep me signed in for today and a tiny little tick box. I do recommend that you tick that box if you're going to be conducting consultations. I don't believe that it would time you out when you were in the middle of a consultation, but if you don't have that ticked, it could easily time you out while you're about to want to log in and see a patient. So if you have that open, it keeps you in there for 12 hours. So once you go in, once you log in, what you will see is a screen like this, and that is your clinic waiting area. This is the CESPHN test clinic that I've used as a screenshot, but normally it would say whatever your clinic name is up there where that arrow is on the kind of top arrow, it's pointing at the clinic name. Right now on this screen, there's no patient, there's nobody there, so it's just all blank. The important parts that you will need to know when you're setting up or when you're using this as a program, one of the important ones is on the left-hand side where I've done the arrow there to the configure. Configure is where you do any changes. That's where you add more team members, where you can add a logo for your practice if you need to, where you can extend your waiting area hours. And just on the topic of waiting area hours, some practices are asking me to set it up with their physical hours. So they say, well, we're only open from 8 to 1. So please just put 8 to 1. So I do that. But what happens then is that at 1 o'clock, the virtual clinic shuts and it will not let any people in at all. So even if you went, oh, I've just really got to squeeze in that patient, I'll see them at 1:10 or I'll stay back a bit late and I'll do them at 1:15 today. Even if you wanted them to come into the clinic, the computer program, like it won't let them. It won't allow the patient to come in. So what I would recommend is you actually maybe set your hours a little bit over, like an hour or so over. Or if you want to, you can set them 24 hours a day, but obviously don't use it then. But yeah, so make sure that you have plenty of leeway, I guess. And even maybe in the mornings the same. So some of my GPs have said, oh, I might do a call first thing, maybe a few minutes before we open or when I first come in. So you can set them to anything. It doesn't have to be your physical opening hours. Also on the configure is if you wanted to change the waiting music, you can add your own audio file. So if you have an audio file that plays when you ring on the telephone, you can install it on this as well. So the patient hears the same messages they would if they were on the telephone hold. You can do all sorts of things, but of course you don't have to. You don't have to change anything. If you want to, you just leave everything as is and the clinic's still ready to go. And the other important parts of this are on the right-hand side here of the screen where it says clinic settings. So one of my arrows there is pointing at the top bit, which says waiting area alerts. Now, I have been recommending to most of the practices I speak to that they have someone in reception has a login and that they are logged in at the reception computer. Now, they don't need to have a webcam on that computer. There's no need for actually seeing patients, but they need to be able to see this screen here that we can see here. The reason being, they treat it like a physical waiting room so that the receptionist can see when somebody is waiting in the waiting room and they can notify the GP as they normally would through whatever, Praxsoft or whatever way you do it. They can mark the patient as arrived or in the waiting room. And the other thing that can be useful for the reception is to add that waiting area alert. There you can either get an SMS, an email, or a desktop alert, like a bell on the desktop. So that can be helpful to just be able to monitor what's going on in there. I would not recommend that the GP gets the alerts, because what will happen is that if I was a GP and I set it to waiting area alerts and I said I want to get an SMS anytime a patient's in there, I don't only get SMSs for my patients, I would get an SMS for every single patient that came in there. So all the other doctors' patients as well. And of course, I don't want to have 10 text messages a day saying somebody's in the waiting room, somebody's in the waiting room. That's not helpful. So it's up to you, of course, with your practice. You may not have this set at all. You may go, oh, well, we've only got one GP. We're quite happy to have an alert whenever my patient comes in. Whatever you like, you can set, but that is a useful tool there. And the most important tool on this one is that share the link to your waiting area. So this is how you get your patients in here. That link can be sent directly from Healthdirect. So here where it says send an email or SMS, you can click onto that and it will pop up, which I think is my next slide. Yes, it is. It will pop up and let you send it. So I'm going to show you that now. Oops, am I going to show you that now? Go. Yeah. So when you click on that send the link, what comes up is on the right-hand side of the screen now. It says invite callers to the waiting area. It comes as a standard template, but you can type over and change any of that. You can change the subject, you can change the invitation message. It comes up on email, but as you can see on the right-hand side, you could change it over to send SMS if you wish to. There is no cost for sending an SMS from here. There's no cost for email either. And that goes directly to the patient. So you just put the patient's email or you put the patient's phone number. The one thing to maybe keep in mind if you send it out of here, if you click it directly from Healthdirect, is that the sender will say HDA, Healthdirect Australia. So the patient might go, why is HDA texting me? I don't know who that is. But it depends on your patients, I guess, if you think that that would be too confusing for them. If you do think that you'd prefer to come from your own software or your own email address, or you already have a way to send out a reminder and so on, then back on the previous page there was also one that said copy link. So you can copy the link and you can paste it into anything you already have set up. So if you're already sending out reminders from best practice or whatever, you can pop it into wherever you're normally sending and it goes out with that as you would normally send out. So either way will work fine. So you send that link out to the patient and that's how they come in. Now the link that goes to the patient, the link is for the waiting room. It is to get the person into the waiting room. So it is not time specific and it is not patient specific. It is the same link for every single patient. I guess that's important to know because if you were making appointments for next week and you sent everybody out the link right now, if some people clicked on it to have a look and check out what it is, they would be waiting in the waiting room right now. They would not only come in at 2 o'clock or whatever for their appointment next week. So again, that might be something you need to think about your own workflow. How will it work for my practice? Some of my practices are doing it quite close to the appointment. They're saying, well, we don't do a lot of telehealth, so we'll just send out the link at the time, pretty much at the time of the appointment. One of the practices are sort of saying, no, that's fine, I'll just send it out as I normally would with the reminder and they will have it and they can come in later. So again, that's totally up to you how you get that link to the patient, but we do need the patient to have the link somehow to be able to come to the virtual clinic. The next screen will show what it looks like. So this again, as you can see on the left-hand side here, that was the text message. I sent it to myself and that's what it said. It said it came from HDA. But the link itself just said, please tap on the link, start a video call at the time of your appointment. And as you can see at the bottom of the link, it does say what the clinic's name is. So it will say, in this case, CESPHN Test Clinic. And then once I clicked on that link, so when I just tapped on it on my phone as a patient, the screen that comes up is on the right-hand side, and that's what it says. It says the name of the clinic, and it just says start video call. So again, there's nothing that says, oh, I need to download something or I need to do anything. The patient just goes, okay, yeah, great, start the video call. The next screen that comes for the patient, I don't think I have, but basically they have to enter their name and their phone number. And if you want them to, we can set it so they have to also add their Medicare number or something. But it's up to you if you do that. But mostly people just leave it as a default, enter your name and your phone number. And then once the patient has done that, they will be in the virtual waiting room. So again, this is what your waiting room will look like when there's a patient waiting. As you can see, there's a time. How long was I waiting for? At this point, I'd been waiting for 1 minute and 30 seconds or so. The name of the patient, now that is what the patient writes in. So if I prefer to be known by a different name and I put my preferred name in, I might not match up with your patient records, for example, but hopefully there'd be enough that it will be sufficient information that you recognize who I am as a patient. And again, I didn't put telephone on this one, but you normally would show the telephone number as well. So the important things, I guess, from now, so we've got the patient waiting. You can see how long they've been waiting. On the right-hand side there where I highlighted, that says notify. And that is if perhaps the practice staff particularly, so when you get your alert and it pops up and says Nerida is in the waiting room, that is where maybe if you say, oh, sorry, the doctor's running 20 minutes late, if the reception, or so if anyone clicks onto notify, a box pops up and you can just type a message. So you can say, sorry, doctor's been called to an emergency. They're going to be quite late. You might say, oh, look, can you just hang up? Come back in an hour. Or you might say, look, they're just 5 minutes late. Just thanks, we know you're there, sort of thing, just to reassure people. So you can send messages as you need to on the notify. For the practitioner, for the clinician, they now say, right, yep, great, Nerida's here, I'm going to join the call. They just press join the call. Couple of things to maybe keep in mind. This is just one patient in the waiting room at the moment. If you're in a busy practice and if you've got more than one GP is going to use this, it's potentially possible you could have 2 or 3 or 4 or more. You could have any number of patients waiting in that waiting room. So the GP needs to be quite careful to make sure that they are picking up the patient that is their patient. They don't want to just click on the first one, the top one, because that might not be the person they want to see. So if there's only one patient, of course, that's easy. If there's lots of patients, keep an eye on it. And once you come into the call, this is basically what it looks like. This is directly from the Healthdirect website. This is not ours, but the one side of the screen shows as the patient, and the patient usually shows as a bit bigger on the GP screen, and vice versa. So for the patient, the GP will show bigger and the patient will just be a littler picture, but you see each other kind of side by side. The important things on this screen to think about, there is the lock button. So the lock button is important because, as I said before, if you're in a busy practice and you've already joined a consultation with your patient, but your colleague is a bit flustered and busy and just quickly just glances at it and sees the first name and doesn't see the last name and says, oh, that's my patient. If they were to click on your consultation while you're already talking to your patient, another doctor could come in as a third person. And it would only be a doctor. It's not going to be an external outside person or anything like that. It won't be another patient or anything like that. But it is possible that another doctor could accidentally, a bit like in real life, if they accidentally opened the door to your consult room and went, oh, sorry, I'm in the wrong room, come back out. So you don't want that. So if you just click on that lock button, it means that nobody can come in. It means you've effectively locked the door, and no other person, even if they accidentally click on it, they can't come in. So I definitely would recommend that. If when you do your consultations, you can't see that lock button, let me know, because I have to set it up when I set up the clinic, and I think I'm pretty certain I've got all the ones done now, but if I sometimes forget, it might not be there. So I can fix that quite easily, or I can tell you how to fix it yourself. It's in that configure page that we talked about earlier. But other than that, you just have your consultation. You're just seeing the patient, you're talking. Now, keep in mind, this is just for the video part of it. This is not your notes or anything. So you will need to still have your medical director or your best practice, or however you normally do notes, you will need to have that open on your computer as well. If you have 2 screens, that's brilliant. You have your video call on one screen and you have your notes on the other, but not everyone has that luxury. If you have, if you're on the desktop, you can split the screen. So you have one half of the side, like one side of the page is sort of taken up with the video and the other side is taken up with the notes. Some of our practices are actually, as I said earlier, you can log into Healthdirect on your smartphone or on a tablet. So some places are using their phone just for the video part of it. You need a cradle or something to sort of hold up the phone so you can look at it, but you can do that. You can just use your phone for the video part of it and your computer as you normally would for notes, however you want. But please just keep that. Again, these are things that you might need to work out with your own practice, how the workflow works. But this program just does the video. It doesn't integrate with notes. It does, though, have some tools, and I don't have all the tools up there. If you want more information, there's lots of stuff online with the help, and I can go through tools if you want to at a future time. But there's things like sharing screen, so you can share pathology results off your screen. There's share a PDF. So if you have a fact sheet that you would like to give to a patient about their child's illness or something that you normally would use, or maybe you would normally print it and hand it to them, on a telehealth consultation, you can just share that. Comes up on their screen and they can actually download it. They can save it on their phone or save it on their laptop, however they're talking to you. So they have a copy of that. There's a whiteboard. So if you want to draw a little picture, you can do that. Lots of things like that. The other important things to think about with your telehealth is if you need a translator, you can also have a translator come in. You can have it lined up an appointment with TIS, and they're, as far as I understand, they're quite familiar with Healthdirect. You can, in this screen here, and it's very small, so I apologize, but on the right hand side where it says there's a green button that says tools, Then there's a little speech bubble. That's a chat box. So if somebody can't hear you very well, whether that's through their, they have a hearing difficulty, or maybe just their speakers aren't working on their computer today, you can type. So you can type chat and do like chat messages there. And the other one that's next to that, it doesn't look like it, but it is people, and you can click on that and invite more people to a consultation. So you could invite a translator. You could also invite a family member. So if the patient wants their, I don't know, if it's an older patient that wants their daughter to join or something, they can join as a video join as a consult as well. You just click that, send out the link onto their phone or email, and they can come straight in. So that's potentially quite useful. And that person doesn't have to be here in Sydney. They can be anywhere. They can be anywhere in Australia, as long as they've got internet and a camera, they can come on in as well. So there's lots of good things, lots of good tools with this. So what do you need for your practice to be able to work? Well, the Healthdirect account, that's fine. You just can apply for that, and I'll show you how to do that in a minute. You will need a camera. So you need a webcam, or you need to do this on a computer, like a laptop that has a camera in it. Or like I said, your smartphone, your tablet, something. You need a camera somehow to get that video through so you can see and they can see you. Look, the dual screens, a lot of these are not compulsory, but they are helpful. The camera is compulsory. The dual screens, not compulsory, but if you had it, that's great. Headset, the same thing. It does help with the sound quality and the so that the patient can hear you maybe a bit better, but you don't have to have that. You can just use the computer audio as it is. The other thing that's very important is that every GP and nurse who is going to use this must have their own login. So you can't, well, you shouldn't just have one for the whole clinic and just have that one, everybody logged in on the same one. Because the reason being, if you're seeing a patient on that one login, and then somebody else, so I'm logged in and I'm seeing a patient, and then Evelina logs in on the same login, the computer doesn't differentiate. It thinks I'm just logging in again. So even if Evelina wanted to see a different patient, she can't. When she clicks on it, she'll just come into my consultation because the computer thinks it's me. We're all logged in on the same one. So please make sure any GP that's going to use this can have their own login. And as I said before, they don't have to have a work email address that can go to their personal one. No one ever sees that personal email. It's just for logging in only. The nurses can also have them, the practice staff can have them, everybody can have one, it's not a problem. And it's useful to have more people being able to access this than not. We've already talked about reception staff, how to kind of monitor what's going on in the waiting room, so that's definitely worthwhile. And the other important thing, of course, is policy for telehealth. So you probably should already have that if you've been doing telephone or any kind of telehealth, but you will need to have some sort of policy in place. And sorry, just one thing I should have said, and can I go back? Yes, good. On this screen here, when I was talking about what it looks like, that red hang up button, it seems rather self-explanatory, I know. You think, yep, that's hanging up, and it is, but when you hang up from the consultation, it usually will come up to say leave call or end call. If you leave the call as a GP, if you leave the call, what happens is the patient goes back to the waiting room. And it might be quite useful if you've got the nurse seeing the patient first and then they leave the call and the patient goes back to the waiting room and the GP then comes and sees them. That's great. Of course, if you didn't mean to do that, it's possible that they will then be hanging around in the waiting room for a while and you're like, why are they still there and what's going on? So keep that in mind. Leaving the call sends the patient back to the waiting room. Ending the call ends the call for everybody. That just turns it off. So that is usually, if you're finished, that's usually what you would do. You would say end call, the patient will be hung up on pretty much, and you will also be gone, and there's no concern about them staying in the waiting room. Because the problem is, if somebody's in the waiting room, whether they're accidentally there because they got their day of their appointment wrong, or because you accidentally went leave call instead of end call, there's not a way to hang up on them in the waiting room unless you actually go into the consultation and then end the call, or unless they hang up themselves. So you can't, you know, which is a good thing, I guess. It means your receptionist can't accidentally cut someone off or something like that. But it could be a problem if you don't want them to be in the waiting room, if they're supposed to have hung up and something's gone wrong. You can't end that call without going back into the call with them as a video call and then ending it that way. So just keep that in mind. So that's it, your requirements for the practice. To get set up, there's a form on our website, or if you have trouble with that, it doesn't seem to be a form. It's a PDF and it's not really editable, which makes things difficult. So if you have trouble, you can contact us on the Telehealth email and I can send you a Word version of that document. And all we really need is the name that you would like your clinic to be. And most people make the clinic, the virtual clinic, the exact same name as their physical clinic, but up to you. You can make it whatever you would like. The name of the clinic, and I also just need the name and email address of the person who's going to be the administrator of this account. Once we have that, we set it up. The administrator gets an email to set up their account, and they're pretty much ready to go, and they can then invite any other staff. They can make any changes they want. If you would like to, and if you want to get one set up and you have a logo or you want to add a few extra team members, please probably don't send me 20 names, but if you've got 2 people that you would like or something, you can send that through to me. I do the bulk of these, but it's not only me, my other colleagues help as well, and we can set those up for you as you send to us. And of course, if you're not sure about how to do it, I can help out with where to find things. But like I said, the help pages for this website are very, very useful. They have lots of great videos. They have lots of great screenshots and things like that to show you how to manage it. So send all of that to our telehealth email, which is telehealth@CESPHN.com.au. And then generally, at the moment, I'm a bit busy, but it's not too bad. And so generally I can get you set up within a day, and usually actually within a few hours. Just depends on what's happening, but we can get that clinic up and running. And like I said, it's ready to go straight away. As long as you've got a camera, as soon as we've set that clinic up, you can start doing appointments that afternoon if you wanted to. I do recommend you do a practice first, but you could, if you wanted to, start straight away. The other thing I guess I should mention when I talk about telehealth, and this is just a mention, I'm not going to go into this. This could be a whole, oops, sorry, I went too far. This could be a whole webinar by itself, but electronic prescriptions and e-pathology. So if you're doing these telehealth video consultations or even telephone at the moment, electronic prescriptions make your life easier and make your practice staff life much easier. The electronic prescription is that token, the QR code that goes straight from your software to the patient's phone or their email. It's a legal prescription. There is no need to print out a piece of paper, sign it, get somebody to fax it to the pharmacy. None of that has to happen. You just hit, basically, instead of hitting print on the form, you just hit print or go on the electronic prescription and off it goes to the patient. So much, much easier. No chasing up what pharmacy do you use, what's their fax number, what's their email, what's whatever. And e-pathology also could be very useful. At the moment, it's just Australian Clinical Labs and DHM in our region, I believe. But it basically, once it's set up, it's the same idea. Rather than having to print a physical form, sign it, get the patient to come pick it up, or maybe email it to them or somehow so they can print it, you can do an electronic version of that goes straight to the pathology lab. The patient can then, I may be wrong about this and I hope I'm not, but I understand that for DHM, if you said this was done in a telehealth consultation, you can indicate that on the order. Then the patient would actually get like a code from DHM, and they know then that means if they walk into the pathology lab, they show their code on their phone, and that, again, scan it, the information will come up directly on the computer. There's no paperwork needed, there's no picking up, there's no faxing, there's no any of that. So that can be very useful. So if you're interested in getting any of that set up, if you haven't already, please contact our digital health team at either at digitalhealth@cesphn.com.au, or if you already know your digital health officer, contact them directly, because they'll be able to get you sorted out on that. Both medical director and best practice are both enabled now for electronic prescriptions. Best practice wasn't previously not working with Medisecure, but as far as I know, it is now. So yeah, you should be able to get that set up no matter what. So that can help in your practice generally. Sorry, now I can't make it go through. And just for general more information, again, like I said, our website is really useful. The RSCGP have a bit of stuff about telehealth. And the other really useful website is the help.vcc.healthdirect.org.au site. And that is the help pages for Healthdirect video call. They're really, really good. Lots of videos, lots of useful stuff. The only probably one concern I have is there's too much stuff on there. So sometimes it's hard when you've got to scroll through a bit to find what you actually want. But everything conceivable, I think, that you could ever ask about video calls or Healthdirect video call is on those pages. So I think that's the end of mine. Yes, it is. So I'm sure we're going to have questions. Let's have a look. Surprisingly, we don't. Surely we have questions. I can't possibly have covered everything. Does anyone have any questions? If you do, please type them away into our Q&A box. One of the questions that has kind of come up there is around expense, the webcam expense and so on. Look, I have to admit, I don't off the top of my head know the cost of webcams, but I know that you can get pretty cheap ones. And by that, I mean, I think like maybe 10 or 20 bucks. I don't think they're super expensive. There's obviously a bit like anything. I'm sure there's much fancier versions as well. So you can get them at all sorts of places. You can get them at JB Hi-Fi, you can get them at Officeworks, you can get them through, of course, your normal IT supplier would more than likely be able to help you with webcam. So generally that you should be able to find something within your practice budget that can be useful. And again, it might be that you only set up the webcam on 1 or 2 computers, depends on your workflow, depends on how many consultations you anticipate being done by video. I know some places have every computer set up, some places have 1 or 2. The issue, of course, if you only got 1 or 2, then if it's all the doctors, they've all got to change rooms all the time, which is not very practical. But yeah, see how you go. So what do we got? Okay, so we do have a question about splitting the screen. I wonder if I could show you on, no, I probably can't. Okay, so if you want to split the screen, now I tried to do this today for a doctor, and for some reason it wouldn't work for me, but I think it did for my colleague. So I don't know if it was just me that didn't get it right, but usually what you do is you would have your web page open with your video call page. You click on the top, so you left click on the mouse, you click right at the top of the screen. So you click somewhere in the top of the web page, and you then hold the button, hold your mouse down, and you drag it to either the left-hand side or the right-hand side, whichever way you want to go. You drag it right across. Once your mouse cursor goes past the side of the screen, it has to go actually past the side of the screen, you can then release it. And usually that just makes it do like a half screen. And on the other half of the screen, it'll pop up to show your other programs that you have open. And you can select one of those, which would go into the other half of the screen. So, you know, you could then select best practice or medical director, and it would pop up on the other side of the screen. Now, let me just, sorry, I'm just going to get one of my colleagues who did fix this. What did he say? He said that you can also do this. Oh, now I can't get it on my other screen, sorry. So, okay, I haven't used this, but Bradley, and I don't know if he's online, but he also said that you can do the Windows logo, so that little Windows picture on your keyboard, you can press that and either the right arrow or the left arrow, and I believe that then slides it off to the side as a half screen, and then you can get the other one up as well. So that might be easier than trying to click and drag, but that's generally how you would split the screens. Question there about PBS scripts and non-PBS. Yeah, absolutely. So there's a question that if a non-PBS script can be an e-script, and yes, any prescription can be an electronic prescription. I'm not sure why it wouldn't have worked for that particular occasion, but generally, yes, there's no any private, any non-PBS, any S8, anything can be an electronic prescription. Again, my understanding is you just do however you would normally do the prescription, but at the end, instead of kind of printing it as a paper, you send it as an e-script. So yes, that one should be fine. Clarify the audio component. So there's a question there about the audio component for the video calls. So again, you have to have some sort of microphone usually, or potentially microphone and speakers for your computer. If you're using a desktop there may not automatically be a microphone certainly available. I'm not quite sure. I think a lot of them do, but I'm not sure if they all do. So you may have to purchase a device that has like a speaker and microphone external that you can attach. If you're using a laptop, that's already built in. If you're using a phone or a tablet, they're usually already built in with speakers and a microphone as well. I guess with that one, if you're having trouble, maybe it's worth either talking to your usual IT supplier just to get them to make sure that you have like the microphone and speaker available, or if necessary, you can also ask us, and I'm sure we could check and see, like your digital health officer could probably just quickly double check for you if that was available or not. There's no specific thing that you have to have. Like I said, you don't have to have a headset, but it is a useful thing because it has both the speakers and the microphone kind of in it, so you can have that straight plugged in and it's useful, but you don't have to have that. You just have to make sure you have some kind of speakers and microphone available for your computer. The other question that's coming up, sorry, Evelina, they're kind of all for me. People should be asking lots. I thought they were going to ask all sorts of curly questions about item numbers and how to claim. The cost of Healthdirect video call once the free trial period ends, that's an excellent question, and I'm afraid I don't know the answer. We've tried to clarify this before when we thought it was ending last year in December, and then we thought it was ending this year in June, and then it didn't end. So Healthdirect is associated with CoView, which is a probably bit more fancy version. It's got more bells and whistles, and I think it starts. CoView starts at around, I think it's around $20 or $30 per month per practitioner, and it does depend a bit on the numbers of practitioners that you're going to have as users and so on. However, that's CoView, that's not Healthdirect. I can't find information that tells me how much Healthdirect is, and my understanding is Healthdirect is the government funded arm, and that basically you're either funded for Healthdirect or you don't have it. But I can't 100% tell you about that. It's also generally our understanding is that, like I said, it has been extended further in the past. Already, actually, for our allied health, that program for allied health and aged care is currently funded until June next year, the end of June. So it's frustrating that they don't sort of give us an open-ended funding, but mostly we have found that it has been extended. I can't say that it will always be extended, but it generally seems to have been extended in line with the telehealth items being available. So I apologize that I can't give you better information than that. But yeah, that's not very clear to us what if there would be any cost once it finishes.
Nerida, there was one more question which you couldn't see probably. Can you set the practice up remotely without having to come to the practice?
Yeah, absolutely. Yep. I don't usually go out to practices, certainly at the moment. I don't go out at all. And I've set up probably, I don't know, maybe 30 or 40 in the last week or two. No, yeah, it's very simple for me to do remotely. I absolutely can set it up. If you then need more training, when COVID's finished, I can come physically, or even right now without coming to the practice. I've also done a bit of either like a personal Zoom session for people, or I can dial in on TeamViewer or talk you through it on the phone or whatever. We can try to get training to people as well. But yeah, no, we don't need to physically come to see you to set this up. There's, like I said, there's no downloads. There's nothing that needs to be installed. So that's all fine. I've got another question about the e-scripts. Yeah, sure. So if the patient didn't receive the e-script, how do you cancel and start again? Okay, so basically you should be able to just cancel the prescription. Basically, I guess as you would if you changed your mind about what you dispensed and cancel it, and then you should be able to reissue the prescription. I would just say if the patient's saying they're not getting it and your end is saying it's sent, well, number one, double check that that they've given you the correct phone number or the correct email, because maybe they've changed their phone number in between, like when they last were there and then this time. But if that continues to happen, that is either best practice or medical director concern, and they need to be notified, and they can log it. They can actually check their logs and see what got sent to what phone numbers and what what happened in the background, because we have had a couple of practices tell us that they've had that issue where a lot of patients were not receiving it even though it said it was sent from their end, and that unfortunately was some sort of glitch in the best practice in that situation, was best practice system. But yeah, so first of all, if you want to, for the first time, sure, just cancel it, as in just like delete, take the prescription, cancel it out of the system, and then redo a new script. Definitely double check the phone number or the email, whatever you're sending it to. But if that happens again, I would say you need to contact the software provider, because I'm not sure why that would be, that that they would continually not receive it. The doctors are set up, but what happens if the patient does not have video conferencing facilities in remote areas? Yeah, okay, so that is a potential issue. So we do need the patient to have some sort of access to a camera and some sort of access to internet. So if it is remote and they do not have internet, if they don't have data on their phone, or if it's too far remote and there's just no actual NBN coverage or whatever, then in that situation, then unfortunately this would not work. There's not a way to do that without internet and without coverage. They can be anywhere. They can be anywhere in Australia. Like, if I know at the moment no one's going anywhere, but if we were going on a nice holiday and we were in Broome and we suddenly remembered, oh my goodness, I forgot to bring my prescriptions, and then they contacted their normal, the patient wanted to see their normal doctor, so they ring up, make a telehealth appointment and say, look, I've come to Broome and I've forgotten everything. Obviously, normally you could do telehealth there, you could send the prescription there as well, but yeah, if they don't have any internet, then that's not going to work on this system, and I don't know of any way that you could get around that with any system, to be honest.
Nerida, can you go a little bit more about security of the platform so that it's safe? Absolutely. So it is. It's all encrypted. The actual videoing, calling, and so on. It is. It meets all of the. I mean, it meets all of Australian standards, in terms of security and so on. And I guess. It is all done through Healthdirect or through the video call system. So yes, it is possible that if the link got sent out to the wrong person, they would have the link, but they don't have anything else. They don't have, they can come to the waiting room, but then again, they're not going to know anything about patient information or anything like that. So in that way, it's very secure as well. As I said before, it's not recorded. If you really want it to be recorded as a practice, you can contact Healthdirect and make a case for them to set that up for you, but I can't do that from my end. I can't make recordings available for anyone, and that has to be set up, I think, and they want to know why you would want to record it and stuff like that. But all the encryption is in place, all of the necessary kind of protocols and security is there, that there should be no concerns at all about people being able to, I mean, again, it would be unlikely someone could hack into a consult or join anything like that. So yeah, the security meets all of our requirements here in Australia. Maybe Evelina, do you have any? I mean, I can answer that question about older patients, but there's a question there about older patients not understanding or not having knowledge of technology, and so how do we do telehealth with them? I mean, I'll briefly answer, but I don't know, Evelina, if you have some other suggestions as well. It depends obviously on your patients. Sometimes, again, like I said, I do a lot of stuff in aged care, and sometimes I go to visit patients and they're like, oh, sorry, hang on, I'm just FaceTiming my friend, or I'm just watching a movie on my computer, or I'm just doing this, and this is 90-year-olds. And, just because they're older people doesn't mean they don't understand it. However, of course, some of your patients will not understand it, and some younger patients may not understand it either. So I guess it does come down to, what do you think is appropriate for your patients? If you think that they could manage to press a link and that they could write their name in and put their phone number, that's all they really need to do. They don't have to download any apps on their phone. They don't have to have anything special. So it's reasonably simple, a few clicks that they can do. And if you've got patients whose first language is not English, we can also, or I can show you how to do it, that you can set up messages that come up on their screen in their preferred or in a preferred language. So I've done that with a couple of practices. usually you can only set it up for 1 or maybe 2 languages. You can't really make it patient specific very easily. But if a majority of your patients speak a certain language, you can put a message on. And I've seen some of my doctors do it so that it immediately comes up in their language saying, yes, this is the video call, you know, you're in the right place, sort of thing. Just press the button or just wait or whatever, because otherwise it's all in English. And if they might understand, put their name in, but maybe then they don't understand that it says you're in the queue, you're waiting, and they go, oh, this hasn't worked, and they hang up. So we can work around some of those things if you need to. But yeah, look, some of your patients, maybe it's just not for them. If they don't have a smartphone, if they don't have a laptop or anything with a camera, then this isn't going to work for them for videos. And unfortunately, then you are then limited, I guess, to those telephone item numbers for them, or seeing them in person, depending on what's appropriate. I guess the other thing is, though, of course, if they're happy for their friend or their family member or whoever to be there, then it is possible to do the video conference with, like, send this to their daughter's phone or something like that. That might help as well. Evelina, do you have any other suggestions about older people or any other kind of things you've come across that how this might work?
No, not for this one. Very often elderly person will have someone who can help them with, maybe a neighbor or a carer. I know it is difficult, especially with item numbers 721, 723, because you can't do them only over the phone, but you still have this short consultation and longer consultation over the telephone, which can cover caring about people who are not so good with the video and new technology.
Yeah, absolutely. So yeah, look, like I said, unfortunately, it's not going to be for every single person, but it's quite useful for a large number. Someone said, can the doctors contact each other using telehealth? Yeah, pretty much you can. There's also ability in the Healthdirect system to use a user room as well. We don't usually suggest that you can, but they're individual to a GP, the user room. And I wouldn't say use that for a patient, because if you do, then no one else can see it. So the doctor, if the doctor doesn't, I don't know, if they're not logged in today, they can't see, they don't know that someone's in their user room and the patient's waiting there on the wrong day or something, but nobody in the practice can see that, because that's only for that GP, that user room. But you could use it if you wanted to, send it to your colleague and say, I want to have a quick chat to you.
Which using platforms such as WhatsApp can bring may not be secure. So I'm just sharing it in the chat. And there is also a question for you, Nerida, if there is a health directory, if there is any directory which can show practices which are using the Healthdirect for telehealth.
That's a good question. I don't know of one. Sorry, Evelina, I think that link you sent, I think you just sent it to us as panelists. So
okay,
if you just,
sorry.
That's right, just send it out to everybody. I don't know of a directory that's, I mean, obviously Healthdirect have a directory, but I don't believe that shows up with, you know, which ones are using the Healthdirect video call. I might take that on notice if possible, if I can put that out to everybody. But yeah, I don't think that there's a directory that shows everybody that's using Healthdirect. I'm just trying to think. Yeah, I mean, and again, it depends on your practices. Some practices have set it up on their website, so you can put the link so that people can go into your waiting room and stuff straight from their website, things like that. You can do all sorts of stuff. But yeah, look, I'm not sure about directory. I'll have to find out. What have I just done for my Q&A? Here's a question.
Yes, there is a question. When you say that there is no record of telehealth, what happens if there is an audit later on?
Okay, so that's going to come down to your record keeping. You need to have that in your best practice or your medical director. There needs to be sort of seen by telehealth, seen on video consultation or whatever, because it does not, Healthdirect does not keep any record of like names of patients. You can do reporting and you can see, you know, the practice this week did 100 hours of video consultations or whatever, but it does not keep the names of the patients or the date of the consultation or anything. Actually, it might have the dates of some consultations, but it doesn't have that kind of auditable information. So again, Evelina, please correct me if I'm wrong, but my understanding is for like an audit from the MBS, you would need to have that in your practice notes, whether that's again in your best practice, your medical director, in your appointment book, I don't know, however you would normally keep track of how you saw patients and things like that, what items were claimed and stuff like that. Yeah, you would need to have that written down. And look, it's probably good anyway to get in the habit of sort of saying, I don't know, confirm the identity or double checked and asked about cost, like if they're going to pay and all of that stuff that you need to get consent and things like that, to have that documented in there as well.
Nerida, one more question. And can you send a patient a copy of, for example, team care arrangement through the telehealth consultation?
Yeah, you can. So that would be where it comes in to share the PDF. So if you are generating the document, again, my understanding is if you were generating it, you would normally print it, but you could generate it and save it as a PDF, and then you can share that PDF with the patient, and they can save it as a file on their computer, or they could, obviously they'd need it from their computer, but they would then be able to print it if they needed to. But yeah, absolutely, you can send it to them. The only thing, I guess, is it wouldn't be signed. I don't know if it has to have a signature, paper signature, like a handwritten signature on it or anything. That maybe wouldn't happen on a PDF version unless you printed it, scanned it. But I don't know with a team care arrangement if it has to be physically signed. So that might not be a problem.
And this question, could you clarify the mechanism for private billing? So if you are not bulk billing practice, you can add the fee, but you, as I said before, you would need to put it for the patient so the patient knows before. You can put the private fee will apply for all the telehealth consultation. After the Medicare rebate, patients will be out of pocket off, and here you put how much. Regardless of consultation length, it's just an example. So you can just set it up like this for your patients. And you should bulk bill patients who have Centrelink healthcare card, pension card, or children under 16.
And I mean, sometimes that might also be when I was saying before how you can leave the call and the person goes back to the waiting room. Potentially you could then get the receptionist to pick up and say, right, you know, you want to give me the credit card or something if you needed to do the billing and payments over that way. They'd need to have a camera if they were going to do that. But yeah, so you can again work out in your practice how best to arrange that, kind of how they pay their fees and stuff. Well, thanks everyone. I think that looks like the end of our questions for now. We really appreciate everyone asking questions and being quite interactive. And hopefully we've covered pretty much what you needed to know. As we said before, there will be an evaluation that comes up at the end. If you've got any questions around telehealth, just email us telehealth@cesphn.com.au, and we can assist. Or if you prefer, if you know your digital health officer or your practice support officer and you would rather just speak directly to them, you can of course do that, and they more than likely can help you with your concerns as well. So I think that's everything. Thanks very much.
Thank you.